We got some good news in Canada. Yesterday, we had a record 132,000 Canadians vaccinated. But how are we doing with this whole vaccination process? And maybe this pandemic in a wider sense. Here to answer that, among other things, is Alan Bonner. He is a crisis and emergency planning expert at Alan Bonner Communications Management, Inc. He is also a member of the Institute of Public Administration of Canada. Good morning, Alan.
Morning.
So let's get right into this vaccination process. And it's funny, I've almost forgotten this is a crisis, Alan, because you've just been living in it for over a year. What is your general evaluation? And then we'll get maybe more into the minutiae of this.
Well, I hate to pick a fight with you when we first meet within the first 30 seconds, but I'm not sure I can answer your question. I can comment on it, but I'm not sure there is an answer. The best phrase that journalism has kicked up over this coverage has been patchwork. The distribution of the vaccine is a patchwork. It is different ways in different provinces, and, that's okay. That's part of being a federation. It's part of the division of powers and constitutional authorities in the country, but it's kind of odd that people, of a younger age are getting it in Alberta than are getting it in some other provinces. You wonder why. I must apologize to anybody who listened to me a couple of weeks ago when I said, beware the Ides of March because the computer is going to crash in Ontario. It didn't. That's great. However, I'm a little vindicated that I think there were about 84,000 people who are over 80 in British Columbia. They turned on a website and 1,000,007 people called and logged on, and they did crash something. I think it was the phone system. So all of which is a long-winded way of saying it is a patchwork. We have vaccines that are not approved, then approved. We have new ones out of Russia and China that some people are concerned about the trials and the testing. So I think it's a patchwork. Long-winded answer, but it's a patchwork.
Look, Alan, I love long-winded answers because I just get paid to listen to you, and it was quite enjoyable. But on that point, I wonder if federally, you mentioned sort of the provincial differences. Do countries need more federal leadership in a time like this? And certainly in the U.S., it's a similar situation where unmasking rules are being thrown out the window. Indoor dining is returning at a rapid rate. And we know that even when you get vaccinated, it takes 4 weeks for even the first vaccination to really take effect.
Well, the U.S. Is, of course, a special case with states' rights. And as Ronald Reagan famously said, the states created the federal government. It wasn't the other way around. And even cities have constitutions. These are some things that are very unfamiliar and in a way disturbing to some Canadians. In England, and Holland, it's traditionally a unitary state, meaning no provinces. So you got the federal government and the national government, then you have cities, so they get administered a little differently. In Canada, I would say this at least causes us to pause and maybe even question our much vaunted national healthcare system. Is it really a national system when the provinces have such different ways of rolling this out? If you're an 80-year-old Canadian in British Columbia versus Alberta versus Ontario, you're being treated quite differently. And, I don't want to go on too much before I mention the different treatment of Indigenous groups in remote areas. I mean, they have it much worse. I'm not trying to ignore that at all. So another roundabout way of saying the different political systems in different countries really have an impact. I'm reading, stand by for the controversial name of the day, but I'm reading Governor Andrew Cuomo's book, which was written before the allegations of impropriety and before we knew that he probably sent COVID-positive people to old folks' homes. It happens to be an excellent book, well written and so on, a little bit partisan. He mentions all the great governors of New York without mentioning Nelson Rockefeller. But he is, and Americans in general, both suck and blow at the same time about states' rights. He's complaining that the federal government didn't help, didn't buy things, and what have you. And I know of no impediment. There may be, but I don't know of an impediment of a big city mayor, a premier, a governor, or a hospital or an industrial concern like Apple, which had a lot of masks in stock. I don't know of any impediment for any of those people buying anything, a ventilator, maybe even a vaccine. So I think that the division of powers is a bit of an excuse for some people as well.
Incredibly well said, Bilal Vakani, in conversation with Alan Bonner. He is a crisis and emergency planning expert at Alan Bonner Communications Management, Inc. He is also a member of the Institute of Public Administration of Canada. You tweeted something really interesting, Alan. It was a short YouTube video about clear risk communication, and I think that's very apt for the discussion we're having now. Can you sort of explain that and maybe apply it in the context of this discussion?
So you're the person who reads my Twitter feed. That's interesting. Thank you.
No worries.
Risk communication is a field of science. It's not actually a science, but it is a field that uses scientific techniques to arrive at the hardest possible conclusion about how to communicate to a lay audience about risk to human health. Now, I think at one time I was the only Canadian with a postgraduate degree in this area, and I may still be for all I know. There are a few Americans. But the research was done originally in the 70s, before my time, by Sandman, Fishoff, Cavello, Tversky, Kenneman, and then a lot of other, academically famous people. I am astounded that the principles of risk communication are not used in this pandemic. I am astounded that the two words risk communication are never used in the top 100 urban emergency plans that I've read to write a book about the topic. And that maybe shouldn't astound me because the word pandemic is only mentioned in one, Brisbane, Australia. So that this is weird in my view. The principles of risk communication are repetition, average, ordinary people commenting as well, the local Red Cross, the local physician, the local science teacher, and so on. There are a number of good principles, and why this isn't being used, it's 50-year-old research, I don't know.
Well, it's so funny, Alan, to try to jump off that great point is the context of this, right? Everybody will point to how Canada's been slow to vaccinate, but what we don't really give ourselves any credit for is that, per capita, we are doing, relatively better than the U.S. in terms of the fatalities. And that discussion has gone almost entirely out the window. It's just vaccinate, vaccinate, vaccinate. And I can't even say it 3 times because I've said it so many other times. I think we lose context. We are so obsessed with the now that even in a year of this pandemic, we've lost the majority of the historical pandemic history, if you will.
Well, that's a very interesting point because there happens to be a draft chapter in my new book about crisis and pandemic planning where there are another 9 authors. And we talk about how epidemiologists and journalists are strange bedfellows. Journalism, as Ted Koppel said in his book, is often in a rush to confirm the obvious. Stop the presses. The police are arresting bad guys. The fire department's putting out fires. So holy cow, let's lead the news with that. But both epidemiologists and journalists are looking at angles. You just mentioned 2 different angles. The cases, and there are half a dozen. The cases, the deaths, the vaccination rate, per capita. There are a lot of different ways to look at this, and that's what epidemiologists do. Both epidemiologists and journalists are engaged in what you might call history on the run, a famous old NFB documentary, and the title of a book by old Knowlton Nash, the late Knowlton Nash, the national newscaster. You're reporting on what's happening right now and today and the newest thing and the most startling thing, and epidemiologists are doing that too. There's a study in Russia. There's one in China. There's one with people over 80. There's no data for people over 65. Pregnant women were not part of the trial, but that doesn't mean they shouldn't take it. There are a lot of variables, and that's what's confusing and annoying people. But unfortunately, that's life. You have to go on the air and do what's happening today, and epidemiologists have to go with the data that they see today.
Yeah, Alan, it is sad because I thought of an example, and I was watching the national news. I won't say which one because it's not going to help me here. And there was this nice lady, and she turned down the AstraZeneca vaccine, and she said, "Well, I heard it's not good, blah 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 blah." And certainly there are other countries that have done that as well as a precaution. But as you sort of read about this vaccine, you listen to our experts, you listen to experts in the UK, the prevailing opinion is if you can get this vaccine, get it. But there's enough doubt out there, and again, this is coming from European governments in some pretty significant countries, that people are not getting this vaccine. And I think, again, it goes back to what we're saying. It's sort of almost all about communication to some extent.
Well, a lot of it is. And as a matter of fact, risk communication tells us that if you feel threatened or you feel that your health is impaired by some activity, it probably is. Guess what? How you think and feel and affects your immune system, your heart rate, your respiration rate, your skin temperature, your pupil dilation. We are living things which react to stimuli. Now, let's talk just a sec about the safety of this, because I want to be really clear that I am going to take whatever vaccine I can get whenever I can take it. A lot of us are taking the flu vaccine every year, and that's between 40 and 70% efficacious, because it's a different strain every year, and a committee of the World Health Organization decides how to formulate the vaccine. And it's a science, but it's an imperfect science. It doesn't mean it's flawless. It just means they're using scientific techniques. So I'm going to take whatever I can get, including I walked into my pharmacy and I said, look, I look a lot younger than I actually am. Can I get the vaccine? And they said no. I called my physician. No, call the city. I called the city. They said call the province. I mean, nobody seems to know. And here's a lesson in management and leadership. We would probably be better off vaccinating people randomly walking up and down the streets of our country, rather than the rollout and the by year and by stress level and vulnerability and all this sort of stuff. Because we may actually be over managing this. This may simply be a case of getting people the vaccine in schools, universities, workplaces, on the street, mobile centers, what have you. So I'm going to get it. Now, that doesn't mean in the history of medicine there haven't been errors and omissions, and I don't need to go into them. Some people will remember the history of thalidomide with pregnant women, even the polio vaccine. I'm old enough to remember my mother telling me stories of the vaccine coming on stream, begging the doctor for it, and our pediatrician said, listen, mother, God has looked after your child this long. Give it another summer. It's not tested. And sure enough, there were some problems. But that was something like 70 years ago. We now have tens of millions of people vaccinated with this one, not only trials in labs, which, were aided by computers and went faster, but also the so-called real-world experience. How does it operate in tens of millions of people? It operates fine. Thank you. I'm going to get it.
Alan, I couldn't agree more. So I'll just end the interview there. Thank you very much.
All right. Have a great day.